Hello, this is Elson Azevedo, and we are starting today a new series of video, and you may realize that we are talking in English because today we have a very special guest, Professor Geoffrey Reed, and this series of video is called Where Are They? So we talk with people that are in some way related to the Department of Psychiatry of Escola Paulista de Medicina, UNIFESP, and we talk to them about their trajectories in order to inspire our young researchers at the department so they can have different views of successful careers. So today we talk with Professor Geoffrey Reed. Let me put you on the screen, Professor. Hello, Jeff. Nice talking to you.
Good to see you.
Yes, I'm going to briefly talk about your curriculum. So if I say anything inaccurate, then you can correct me, okay? So Professor Geoffrey Reed, he is originally from California, San Francisco Bay Area, and he studied at the UCLA. He studied psychology, had his PhD there. He was an assistant professor at the University of California in the Department of Psychiatry. Then he went for Washington University, where he had his postdoc. He was for 11 years at the American Psychological Association. He was assistant executive director for professional development. And after that, he went to WHO. He was senior project officer. He was the head of the ICD-11 for mental health, mental and behavioral disorders at WHO. He coordinated the implementation of the studies and the review of the ICD. He now is a professor at Columbia University, professor of medical psychology, and he's an amazing researcher. He was at some point, some years ago, involved with research in HIV when the epidemic started. And I had the privilege to be a little bit close with Professor Reed during the ICD-11 field studies for mental disorders. And I cannot state enough how much I admire you, Jeff, your leadership, your intelligence. It was an amazing time for me being close to you and learning how you directed such a complex project with several countries. And it was a great honor to be part of it and learning from you. So Jeff, the idea of this video is to talk about your career, your trajectory, so our young researchers can have references of successful careers. So how it all began for you, your trajectory?
How did it all begin? I had always been interested in psychology, and so when I was at university, I took some introductory psychology courses, I guess, in my freshman year, and I thought it was extremely interesting and wanted to pursue it, and so I ended up majoring in psychology as an undergraduate. I had initially imagined that I would go to medical school, but then found that it was psychology that I was really interested in, and I was interested in research also. And so I thought that a PhD program in psychology was a better fit for me. And when I went to school when I went to graduate school, I finished in 1989. So during the period of time that I was in graduate school was really when the HIV and AIDS really hit in Los Angeles in a very powerful way. And so I felt like there was some kind of imperative to use the skills that I had to try to assist with this really incredible disaster that was occurring at the time. And so I became involved with a project on the psychosocial aspects of HIV infection and AIDS. That was really a very innovative project because it was looking at the relationship between psychosocial factors and immunological parameters and disease progression in people with HIV and AIDS. And this is
Wow.
before treatments had really been developed. And it was part of the multi-center AIDS cohort study, which was this big study that had 5 different sites in the United States with thousands of gay and bisexual men enrolled at each site. And so I eventually was the project coordinator for the Los Angeles part of the psychosocial study.
Wow.
That's really how I got involved in research, really started from there.
So you had such an important position as a young researcher. You were...
Well, I mean, so you know, a project coordinator position is not really so unusual for a young researcher to have, and that's what I was. So I left UCLA and I went into my postdoc in Seattle, as you mentioned. And you know, in the United States, usually you have to do a certain number of clinical hours to be licensed. And so I did my postdoctoral hours so that I would be eligible to be licensed as a psychologist. And then at the end of that, I went back to Los Angeles and took this project coordinator position with the same project that with which I had done my dissertation. So it was a project that I already knew.
Mm-hmm.
So I really ran the research, the psychosocial part of the research for the Los Angeles site, and wrote papers as part of that and was involved in research. And you know, that was all really very interesting. And after a couple of years, I actually became a co-investigator on the grant. So it was a really good opportunity for me to develop and grow as a researcher. And then I think the part that is not so traditional is I felt like we were really responding to this. You know, it's hard to imagine now what it was like at the time with so many people sick and dying, and what the impact of that was. And I felt like there was just really urgent needs to change the healthcare system and to improve health equity, and many things that really needed to be done to address some really pressing problems socially and health-wise. And I was, in that moment, a little discouraged about the impact of that, on that I might have as a researcher. I kind of felt like, you know, you send in your articles and then you argue with the editors for 6 months about whether you did your regressions correctly. And then eventually your paper comes out, but it's hard to really have some sense that are you really making a difference in the way that care is delivered to people, which I thought was really urgent. And so I went to Washington, D.C. I took the position with the American Psychological Association because I thought that this might be a way that I could have more impact on the delivery of care. And it was, in a certain way. I worked on a variety of projects there about how to integrate psychological perspectives and mental health services into medical services for people with breast cancer, or in the military context, or in another project about substance use. So I had the opportunity to do several different research projects that were more applied in that context, that I thought could have an impact on the delivery of healthcare from that position. And then, you know, I had been interested in international issues. I had learned to speak Spanish. I was particularly interested in Latin America, actually, and had this opportunity to start working with WHO while I was at the American Psychological Association. The reason for that was because there was this move at the time saying that the American Psychological Association should develop its own classification system, which, you know, was partly in response to the American Psychiatric Association's ownership of the DSM and the complaints that psychologists had about the way that the DSM was working for them. And I didn't think, you know, in my position, I was asked to really look into this, and I didn't think that it was really realistic for psychology to have some kind of competing classification system. It wasn't worth it in terms of the likely uptake and in terms of the success of that kind of a project. But in talking to psychologists about what the problems were that they have with classification, what I learned was that really a lot of times what psychologists were doing was to help people improve their ability to function. And so if you have a mood disorder, it doesn't necessarily mean that your mood disorder is going to go away. You know, you can treat it successfully, you can prevent most of the episodes, maybe if your treatment is going well, whether that's with medication or with psychotherapy. But really what improves over the course of treatment is not necessarily the diagnosis that somebody has, which can be lifelong, but how they function in their lives. And the diagnostic classification really didn't seem to capture that in an adequate way. So we looked at what systems were out there for thinking about functioning, and we found that there was this international classification for functioning, disability, and health that was produced by the World Health Organization and was at the time undergoing revision. And so we communicated with the World Health Organization, and they were receptive to our involvement. You know, WHO is often operating on a very small budget, really a shoestring for big responsibilities. And so they often are open to people that come from organizations that can help institutionally. So we began to be involved in the revision of the new version of it's the ICF, the International Classification of Functioning, Disability, and Health, that was approved by the World Health Assembly in 2001. And so we worked quite a lot on that. And the American Psychological Association was actually the biggest site for the North American field studies. And I was able to be involved in some publications related to the ICF and got to know people who were part of the WHO family of International Classifications Network. And so when the ICD revision began around 2005, I was in a position to be invited to be involved in it. And eventually originally I was actually appointed to one of these committees that was working on the development of the ICD, but eventually that turned into my having this project coordinator or senior project officer position with WHO.
That's amazing, Jeff. And I wonder, how many interesting people have you met working with experts from all over the world? How many travels? That must have been interesting as well.
Yeah, that was really one thing that was great about it. I feel like, you know, working with the American Psychological Association, I had a lot of institutional experience and working with a lot of different constituencies and groups of people within the association, but then taking that to a global level was really a whole other challenge. I thought the traveling that I did, I mean, it became exhausting at times, but it was really incredibly interesting to be able to go all over the world, like all the times that I came to Sao Paulo to work with your department and other leading institutions around the world, in China, in India, in Africa,
Wow,
really all over. And so
Japan.
I love that part of it. Japan, yeah, we went to Japan a few times. So we developed this really strong network of collaboration. And, you know, people become friends. So you spend a lot of time working with somebody, you develop a lot of collaboration, a lot of productive work together, and that really leads to other kinds of opportunities over time. So that really has been, I think, the most rewarding aspect of it for me.
Yeah, that's for sure. So I was wondering, you had this perception that the functioning was key, had to be more important in our diagnostic system, and the field is now more and more open to this idea, and we are realizing that just treating the symptoms is not enough to reduce global mental health burden. And that's amazing that you captured that so many years ago, and it was able to put that as a central in the center for the development of the ICD-11 chapter for mental and behavioral disorders.
Yeah, I don't know, you know, how entirely successful we've been at that. I think functioning is still an incredibly important dimension. I think that there's problems with the ICF, the International Classification of Functioning. I think it's difficult to apply in clinical settings. I think there needs to be a better set of measures to really help us assess functioning, but certainly I agree with you that there's more and more awareness of the importance of that, so that in schizophrenia, for example, it's really the functional deficits that can remain after positive symptoms are treated, and we need to be able to really target treatments much more effectively at the functional aspects of it. So I think this is still an area where there's a lot of work to do, and I think, you know, it's an area of interest for me, certainly.
Yeah. Well, I think that, I don't know if it was your input in the ICD-11 revision, or that was already the idea of the leaders to have the central role of how to make it easier for the clinician, the encounter of the clinician with the patient, so that the classification is helpful, more helpful at this encounter. Tell me, in your, what do you think was the greatest advance in ICD-11? What do you think it helped in comparison with other classifications?
One of the things I think that was most important about what we did with the ICD revision was really our focus on clinical utility. I believe that clinicians have a huge amount of expertise in terms of how they encounter and treat patients, and also that clinicians want to do good work. And I think too often the attitude of researchers has been that, you know, oh, these stupid clinicians, they don't know what they're talking about, and if they would just, you know, follow the research, then everything would be better. But I think that's not really true. And so in a classification system, what you really want is clinicians to find it useful. Because if they don't find it useful, they're not going to apply it in a kind of systematic and faithful way. And then all of the data that you have that comes from health encounters is not going to be useful and reliable for all the reasons in which healthcare data get used that really come from health encounters. And so we really approach this as an empirical question, as a scientific question, is how do you assess the clinical utility of a classification, and what does that look like, and what are the dimensions that you should be considering? And I think that's really shifted the discourse quite a lot about what you should be thinking about. And I think we've been really recognized for our systematic approach to the study of clinical utility as a core dimension of classification systems. So I think that's been a big thing. I also feel generally good about the empirical basis for what we've done with the ICD. That's been really pretty incredible. We have something like 400 papers now that have been related to various parts of the classification from centers all over the world, including the Federal University of Sao Paulo. And the collaboration that we've developed has been incredible. We did our field studies in 14 countries, including Brazil. You know this because you were the project coordinator of the Brazilian part of the field studies. We also had a network for electronic field studies, the online studies of over 15,000 health professionals all over the world in 159 countries, doing studies in 6 languages. So the breadth of participation was really another aspect of it that I think has been really successful beyond anything that I had anticipated to begin with.
No, that's amazing. It was a huge project with collaborations all over the world. And people, even people from DSM-5, like Professor Michael First and several others. So ICD-11 was really, in my opinion, the best of the best, thinking about how can we make the best classification for the knowledge we have nowadays. So it was amazing. And I wanted you to talk a little bit, Jeff, about how did you start the collaboration with Federal University of São Paulo, with Professor Jair Mari? How did that start?
Well, so you know, Professor Mari has been involved in international collaborations for a long time and is well known around the world. He had been appointed to another group that Norman Sartorius was leading that was looking at international scientific issues related to the ICD-11. And I met him through his participation in that group. And we just spent time together talking, and I really liked him. I thought he was really practical in his approach and down to earth, but you know, very positive about the future and really dedicated to the development of young psychologists, but also people from other disciplines. He has a really multidisciplinary research team. And so it just seemed like this would be a really good possibility for collaboration. And so we set up this group about field studies for ICD-11. That was the field studies coordination group, and I invited him to be a part of that group along with other people from all over the world: China, India, Japan, Mexico, and many other countries. And so he participated in the development and oversight of all of the field studies that we did. And when we began to do field studies in clinical centers, then we considered sites that would be useful for data collection. Then, you know, obviously Brazil was an important site for us to consider. And so the 2 big Latin American sites that we had in all of our studies were Mexico and Brazil, which are, you know, 2 biggest countries in Latin America. And so that was a really important aspect of what we did.
Yeah, so, and this collaboration started around 2010, something like this?
Yeah, so I think...
something like this.
Yeah, he was participating in this group about scientific collaboration probably from 2008, and then I think we appointed this field study for, the coordination group for field studies, I think was appointed in 2011. I think they had their first meeting. Would have been around 2010 that we were evaluating the candidates and doing the appointment.
Almost 10 years.
And involved in this, yes.
Yeah, and we had the privilege to have you here in São Paulo a couple of times.
Yeah.
For meetings, ICD-11 meetings. It was great to have all the researchers here. And you need to come back to meet our new home. We have now a new facility. We just, around 2 years ago, we moved 500 meters to our previous.
Because that building that you were in before was relatively new when I was there, no?
Yeah, but it wasn't the definite one. We now have a very huge hospital that is the home of the Department of Psychiatry. It's one of the most important mental health hospitals here in the state of São Paulo. And we are, well, with big plans.
I'm interested in collaborating more with the university. First of all, I mean, my collaboration with the university was the first time that I had been to Brazil, and I had, you know, a wonderful time there. I like very much the country and the people, and just everything about it. So, now I have to travel outside of Sao Paulo. I've been to Sao Paulo, I think 3 times or 4 times, but to mostly in relationship to our collaboration with your university. But, I'm interested also in seeing other parts of Brazil, but I think there will be more opportunities for collaboration as we go forward with different research initiatives. You have been working very much with our department. So, I work with Milton Weinberg in the Columbia University Department of Psychiatry, and you have been working with Milton in the project that you have in Mozambique. I have started to work with Milton also in the Department of Psychiatry, and so I hope we can come up with some other opportunities for collaboration between our university and yours going forward.
Amazing, amazing, Jeff. So going more for the end of the interview, I just wanted to know what are your main interests nowadays after completing the ICD-11 project. What do you consider are your next steps?
Well, so there's still a huge amount of my energy that is devoted to the ICD. It's funny because I didn't really start out to be so interested in classification. It wasn't like I was like, oh, I'm really interested in diagnosis and classification, but I became involved in it over time because of my connection with WHO, and I came to see how it really forms the basis for so much of health. It's really incredibly important. And it was also a way to really advance my interest in clinicians and their knowledge. Now that the ICD-11 has been approved by the World Health Assembly, which happened last year in May, we still have to work on implementation. So each country will decide how they're going to implement and when they're going to implement. And so I don't know what the current status of Brazil's implementation is, but they might decide, well, we're going to do it starting in 2022 or 2023. And so we have to work with Brazil and Brazilian institutions about how to do that. We have to develop training materials related to the ICD-11 so that clinicians can educate themselves, ideally for also residents and psychology interns and other people that will have to use it. So there's still this huge project of training and implementation related to ICD-11 that will continue to take up some portion of my time. I also am developing other areas of research. One thing that I have become very interested in because of the time that I have spent in Mexico is I was based in Mexico for around 5 years. I'm still in Mexico. I mean, I'm in Mexico now. I'm talking to you from Mexico.
Really?
I'm very interested in issues about migration and what leads people to feel like they have to leave their homes and go someplace else in search of a better life, and what can be done to provide services and resources so that people don't feel like they have to leave, and what they experience during the process of migration. I have, of course, been horrified by the policies of the current US administration toward migrants. And so I have begun a research project in collaboration with Maria Elena Medina Mora at the National Institute of Psychiatry in Mexico. You know her.
Sure.
To evaluate now what happens with migrants who come from Central America headed toward the United States is that they mostly get stuck in Mexico. And so there's this unknown population of people who left their homes in Central America and even from Southern Mexico as well to try to get to the United States and are now kind of stranded someplace near the northern border. We don't know how many they are. We don't know their health status. We don't know what kinds of experiences they've had. We know that there are high levels of violence that they're exposed to. We need to know about their nutritional status, because really it's likely that eventually Mexico will have to figure out how to provide services that are needed for these people, but also to integrate many of them into Mexican society. And So we need to know what they need, and we need to know about what's happened to them. So this is a project that we're doing now that started out with a small focus specifically on Tijuana, but once we have the data from the Tijuana area, we expect to expand it to a national study. So that would be one thing that I would be interested in going forward. I like projects that involve international collaboration. I like projects that have important kind of social implications, like the migration project. So we'll see what kind of opportunities present themselves. So one of the things I would like to do is talk with you and Jair and other people there. I was so impressed with Brazilian researchers when I visited before. And so I think some collaboration with Brazil going forward would be a priority for me as well.
That's great, Jeff. I know our young researchers are going to be thrilled to know that you are eager to continue collaborating with us, and that's great. Maybe you can set up some joint discipline for our post-graduation program. I don't know. Let's think about it. Now that we have the technology, we are used to having classes with Zoom or other platforms. That would be great to think. Join
it's been a real challenge during this time, isn't it? This is the longest I've been in one place for years, I think. I've been here in Mexico City for 6 months now without traveling anywhere. And that's been, in some ways that's been nice, but I miss, seeing my friends in other countries and, having other kinds of experiences. But you would think that the work would have slowed down, but it hasn't really. We're all just as busy as ever. So.
That's for sure. So Jeff, we are now at the end of our interview. Thank you so much for your participation. I'd like to restate my invitation for you to come visit our new home in the department, our hospital. And as soon as this pandemic is over, we are going to set something up to have you here with us. And I'd like to finish the interview asking you to say something for our young researchers. How can they dream about a career as successful as yours?
Well, I mean, I was lucky to have certain kinds of opportunities that in some way, in part it involved being in the right place at the right time to be able to take advantage of something. And so I think, I would say, I think in a country like Brazil, this is true in Mexico, it's not like research pays a lot of money. So you have to do it because it's something that you really want to do. Ultimately, I think it's the most interesting. It's the area where you can really discover new things. You can keep learning, you can change. Clinical work is interesting at first, and I think it's an important part of what we do as health professionals, but clinical work alone eventually becomes repetitive, and so it stops being so interesting to many of us. So I think those of us who are really drawn to research, there's a kind of an intellectual component of it. It's a way for us to keep learning and keep growing and keep discovering, and that there's a back and forth that happens between how it informs our clinical work and then how our clinical work informs our research. And I think you just have to keep doing it, and that, a lot of times the world is not ready for your idea at the point where you're working on it. But if you just keep doing it, eventually there's an opportunity in the world and you see it and you say, you know what, I have already thought about this. I have the project, I have already written the paper, or whatever it might be, that you say, yes, this is an issue. This is something that I have been thinking about. And now I see this opportunity to fit this into something that is of global importance. And I think you just have to keep that kind of flexibility and just not give up in terms of what you think is important and what you think is interesting.
Wow, amazing, Jeff. Thank you so much. It was a great pleasure talking to you again, and hope
it's great to talk to you. I'll see you soon.
Okay, bye-bye. See you.
Thanks, bye-bye.